Okay, ready whenever you are, Governor.
Okay, good afternoon. It's been busy with the legislative session here and our vaccine response. So let's dive in. Today we have some really good news. It's been about a week since I announced our new measures to accelerate our vaccine delivery system. And I have this we can now say, these measures are working. We certainly have a long ways to go, but we have made very significant progress in the last week that I'd like to share with you because we know how urgent this mission is, and we know how eager, and this is good news, that Washingtonians are most eager to get this vaccine. That's really good news. Just to share some of the data with you, just about a week ago, we were administering about 14,000 doses a day, and now about a week later, we're up to about 24,000 a day on a 7-day rolling average. That's on the rolling average. So we've had about a 10,000 dose per day increase on a week averages. And to show you how far we've gone just the last few days, let me just show you this chart here, which shows over the last several days. As of January 19th, we did 16,146 doses. This past Saturday, we did 36,478. And Sunday, big day, we did 39,063, just short of our 40,000 number. And as you know, it is our goal to build up capacity so we can do 45,000 vaccinations a day. It's very significant progress. These increases are attributable to multiple sources. One, we've had better reporting. We've had new provider requirements that require providers to accelerate their administration within 7 days to do 90% of their doses. We've had a massive public-private partnership with Microsoft, Starbucks, Costco, Amazon, business and labor leaders. And we've had the cooperation of thousands of volunteers and communities across the state of Washington, for which we are very appreciative. You are witnessing communities coming together to stand up multiple ways to deliver this vaccine, multiple ways, and that's what we need. We cannot depend on just one hospital or one entity. We've got to have every play in our playbook, and that's happening across the state of Washington. Monday, we had again about 39,000 doses administered and reported to the state. So I'm pleased to say we are at about 32% of our doses maybe 2 weeks ago. We now are up to 57% of the doses have been actually delivered. And this will continue to go up as providers can actually report. There's many, many more that have been vaccinated that simply are not in our data system yet. So good news, we have now tapped the 500,000 point. We now have over 500,000 Washingtonians who have received the vaccine. That's great news. Trudy and I had the vaccine last Friday at the CMAR clinic, and we're very appreciative of this miracle. It is a scientific miracle, and it is a fruit of tremendous work being done across the state of Washington, and we appreciated that in a very short time frame. But we still have a long ways to go and many days to get there with the number of people we need to vaccinate. There are hundreds of thousands of people, obviously, that are eligible for vaccination who have not received it. There are more than 800,000 Washingtonians today who are eligible for the vaccine but have not been able to receive it because we simply have not have enough doses, have not been provided yet from the federal government. So we now are vaccinating as much or more people than the doses we have coming into the federal government. And therein lies the challenge. So what we have while we're waiting, and the frustration I know people is profound. We hear stories of people who are calling multiple places to try to get appointments. And we know people everybody would like to be vaccinated before noon tomorrow. I do want to say though, while we're waiting, we've got a couple things that perhaps I hope people will keep in mind. Number one, we can protect ourselves while we are waiting, and this is important to say. There would be a tendency now that the vaccine is near or here for many people to let up our guard, to reduce our mask usage, to allow more people to come into our home and have dinner and socialize. It's so close. That would be so tempting for all of us. Actually, at this moment, we got to double down and increase our protection of ourselves while we are waiting for the vaccine, in part because these new variants are coming on that we think are much more transmittable and potentially could be more fatal. So what we have while we're waiting is the strength of agency to control our own destiny, to protect ourselves while we're accelerating the delivery of this vaccine. As far as the time it will take, I'd love to be able to give everyone an individual date by which they will receive the vaccine. Obviously, that's not possible. But we know that it's going to be some weeks until we can get through the next tranche to get to the next group of eligible folks, because we've got about 850,000 people we would need to vaccinate, and we're only getting under 100,000 doses, or a little more than 100,000 doses a week. So it is going to be some time. But here's some really good news. Look, the limiting factor ultimately is the number of doses we receive from the federal government. And on that front, we were on a call today, the Governors Association, with the Biden administration vaccine team. And they told us just a couple hours ago that we could expect a 16% increase in our allotment nationally, and that will boil down to about a 16% increase for our state, and that would be a certain delivery schedule for the next 3 weeks. So having a 16% increase is really great news. It's also great news that they're giving us certainty of those delivery, because our providers have been bedeviled with uncertainty and unpredictability of the delivery schedules. On top of that, they will also deliver to us the special syringes that are used to coax an additional dose out of every vial of the Pfizer product. So instead of having 5 doses of a vial, we will have 6. So we have an additional 20% of the Pfizer product. The 16% increase will be a combination of the Moderna and Pfizer product. So this is really great news that in such short order, the Biden administration has been able to produce an increase of supply, which is the ultimate issue that we have to deal with. That's really great news. But we've got more work to do, and we've demonstrated what we can do in 1 week, and we need to continue that acceleration process. I want to credit everyone working on that, including our Department of Health, our medical providers, our public and private partnerships, and those who are eligible right now who are scouring the state for those supplies. This week, our 4 new mass vaccination sites are coming up to speed. I was really excited to see one of the first people in the state who were vaccinated by General Jim Mattis in the Tri-Cities. That was really exciting to see a picture of him at our mass vaccination site. They're fully operational, all 4, I believe, will be fully operational as of tomorrow. And they're not alone. There are 886 providers across the state currently enrolled in the vaccine distribution program, with every county having at least 1 enrolled provider. Some providers, like pharmacies, have multiple locations where they're offering the vaccine. And we've got another 500 providers lined up pending approval. Now, as far as finding vaccine, this is the great search for all of us in the state of Washington. And we know that this is certainly frustrating not to be able to do this for everyone, but the doses simply don't exist to be able to do that. So we do encourage people to check out the Phase Finder program that can help you in that search. That's findyourphasewa.org. findyourphasewa.org, or at the Department of Health's website, it's doh.wa.gov, doh.wa.gov. And the good news is that people are getting their vaccines. And I got to tell you, it's a thrill every time I hear someone that I bump into on the street or otherwise say they got their vaccine. That's good news. And I know there's going to be frustration about that while we wait. And people will handle this differently. I saw a woman of some age who was parked in her car at one of the spots getting a mass vaccination, and they asked her what she thought about it. And she was waiting for like a couple hours to get her vaccine. And she could have just said, you know, this is terrible, I have to wait. What she said is, I'm just blessed. She just felt blessed. And to some degree, that's true. That won't make us all feel better. But thank goodness we got this miracle vaccine available. And now that we're making really profound progress in getting people vaccinated in our state. One other thing, someone brought up an issue about counties on the relative distribution in the state. Someone brought up a concern about King County. I checked on this today. King County has actually received about 32% of the vaccine since the origination of the program. They're about 30% of the population. So King County is receiving sort of a per capita basis over the length. There is going to be variation from one week to another. So not every county is going to be exactly there per capita that week, but over time, we're going to hit the equitable mark, and we have in regard to King County, and that will continue. Quick legislative update. Legislators are now in the third week of the session, and we are encouraged by the progress being made. Last week, the Clean Fuel Standard passed out of the committee in the House, and in the Senate, there was a hearing on the Climate Commitment Act, which would cap carbon emissions and then use the funds generated by that in communities most impacted by the climate crisis. Very happy about that. I read some horrific news yesterday about the acceleration of climate change, which is quite troubling. And it's great to know that the Washington legislature is going to step up to the plate this year and do our part to defeat climate change. A Senate committee has also approved legislation that would help small businesses avoid skyrocketing unemployment insurance rates due to the pandemic. And we think that's the right thing for our businesses. With that, I am happy to stand for questions. Dr. Shaw, I think, is in Port Angeles today, but we have, I believe, Michelle and Dr. Lindquist on the phone if you'd like to ask some questions.
First question comes from Jean with AP.
Hi, Governor. Thank you. Today, President Biden issued an executive order instructing the DOJ not to renew contracts with private for-profit prisons. I know there is an effort in the legislature this year, House Bill 1090, which would ban private for-profit detention centers from operating in Washington state, including the Northwest Detention Center in Tacoma. Do you support that bill? Should the Northwest Processing Center, be shut down?
Well, I am supportive of the concept that private prisons are not the way to go in the United States or our state. So I'm supportive of that concept. I haven't looked at the specific bill to see if there's any glitches in it, but I'm certainly supportive of that position. I'm glad President Biden has taken that position.
Next question comes from Joe with the Seattle Times.
Governor, two-part question for you. Curious to hear your thoughts as you look for a new corrections secretary in the wake of Stephen Sinclair's retirement. What sorts of qualities are you looking for a new secretary in terms of the same or opposite of what you've had recently? And second, tomorrow there will be a hearing on Senate Bill 5170, which creates a one-year cooling-off period for lobbyists. You had a staffer go recently over to lobbying very quickly, as has been a tradition for decades in Olympia. Would you support a cooling-off period for that this year?
So the DLC position, we will look for someone who can help bring an approach to our Department of Corrections that will reduce crime by doing what they can to assure that when people leave custody, and the vast majority of people go back to our neighborhoods and our communities, that they are ready to re-enter life, both vocationally and through their mental health and drug issues, to make sure that they don't reoffend. The purpose is to prevent crime. And so having used our department in a way that will reduce crime by preparing people so they don't have to go back into a life of crime, that is a significant mission statement for us. And we'll be looking for someone that can help us reduce crime by preparing people for release so they don't reoffend and we don't have the problem of recidivism. That's one of the things. Secondly, we'll want someone to administer the system in a fair and equitable and efficient way, of course. Third, we'll look forward to someone who can work with the legislators to do some of the reforms in our criminal justice system so it actually is effective in reducing crime rather than just lodging people at extraordinary expense without actually reducing crime. We've had a number of measures to do that, and I'm hopeful that the next person will help legislators move in that direction. And if we find a person like that, and I hope we do very shortly. The cooling off period, I haven't looked at this issue. I'll have to get back to you on this, Joe. I've not had a chance to think about this during the COVID pandemic, so I will have to get back to you, which I will do in a few days.
Next question comes from Tom with KEPR.
Governor, there are a lot of people very excited about the mass vaccination clinic that's out here in the Tri-City. Happy to report that 500 people were vaccinated out here yesterday. And there are 700 that are expected to be vaccinated today. It's not all smooth sailing, though. You announced this on the 18th that they were going to have these mass vaccination clinics. But it wasn't announced until the 25th that people needed an appointment. And that was after our vaccination clinic opened. So at first they were serving people on a first come, first served basis. They've changed their ways. Now it's by appointment. Several elderly people didn't get the memo that they needed an appointment time. And we had people waiting out there at 3 o'clock this morning, only to be turned away at 8 o'clock. And you can imagine people are frustrated. Is that an adequate timeline to tell people you need an appointment to get these vaccines?
Well, I certainly understand people's frustration that everything hasn't been perfect in this life-saving mission. I'm thrilled that 500 people had it yesterday and 700 people may have their life saved today. And we would like to be able to save 1,200 lives over 2 days and having zero inconvenience for people. That would be wonderful. We weren't able to accomplish that. I can assure you that everybody's going to work as hard as they can, and they're doing it. We have stood up these sites with exceptional rapidity and efficiency in my eyes. And I'm just glad we got Jim Mattis vaccinated. And I want to thank the National Guard for their assistance in getting these sites stood up. This is a considerable logistical hurdle to combine the notice, the appointment process, the security, the refrigeration, the site itself, and make sure everybody's good with all of those things. It's a lot easier to write a story about this than there is to really stand up these sites. So we're doing the best we can, and I'm glad we're saving people's lives.
Next question comes from Sarah with McClatchy.
Yes, this is about vaccines again, so it might be Michelle, but Governor, you might have some comments on this as well. There are seniors right now who are eligible for a vaccine but aren't comfortable using or don't have access to the technology necessary to sign up online, which is the method to get an appointment for many places. So I'm curious what outreach is being done for those seniors who are among the most vulnerable to the virus but may not have that access.
Michelle, would you like to talk about that, and then I can offer something?
Yeah, absolutely. That is a really critical point that we need to reach people in multiple ways, and through the web is not going to be the right way to work with everybody. So that's why we're sharing information out through our area's agencies on aging, senior center partners, other community partners, so they can help reach them. And we also are making sure we have phone line access as well. I think people probably know that we including at DOH, had too many phone calls coming in. And so we're working on establishing to make sure that our phone lines can handle the volume and continue to make it as easy as possible for each person to know where to get vaccinated. We're working on all the providers with the providers who are enrolled as well for them to help with solutions about either technology or phone systems to keep talking about how are they going to handle the volume of calls that are coming in as well. So it's really multifaceted with a lot of different people working on it to ensure there's multiple ways people will know about how to get vaccine.
Yeah, I would also say that, one of the things, it's like in any emergency, in an earthquake or a mudslide at Oso, what I've learned is that a significant part of the rescue is by individuals. It's by us. It's taking care of our neighbors, our relatives, extending a hand to maybe an older person to give them a hand, grandkids that help their grandparents, this is a moment in time where all of us can step up and help people, particularly the people, like you say, who might be challenged when it comes to technology. I encourage people to find a way to help other folks, and they're doing it all over the state of Washington. It's really impressive to me how fast communities have come together to set up these distribution sites. It's been very, very fast, despite the fellow from the Tri-Cities who was asking this question. Look, you can't get this done in 45 minutes, and people really are pulling together. So we hope people will continue to do so. I think you will also see during this process that it will become smoother as we go along. As communities understand the templates, understand how to form these partnerships, it's going to get better. It is getting better dramatically. We've doubled the number of doses we're doing, or almost tripled the number of doses we're doing. This is incredible progress we're making. Maybe we could just celebrate saving life for a couple minutes here. I certainly am.
Next question comes from Simone with Q13.
Hi, Governor. I wanted to ask you today about your reopening phases. Is there any consideration you're making to change needing to meet all 4 of these criteria? I noticed the governor in California recently changed his restrictions based on ICU capacity. As we look across the state, all but one of the regions is meeting that ICU capacity threshold that's been laid out. So is there any thought on your end to be adjusting this so that regions don't need to meet all 4 of these? And on top of that, any more future discussions about allowing some of the counties that may be doing better than the rest of the region to be able to split off from this regional approach? Thank you.
I can tell you we have not thought about changing the regional. There was a reason we went to regions. I've articulated those, that we wanted to be consistent with the medical delivery system. We wanted groups to work in concert in those regions. So no, we're not thinking about changing that. We're always thinking about our phases. So we're always looking at other potential options. I'd be cautious about comparing our situation to California. Our systems are very different. I know people thought that all restrictions were lifted because of a headline from California. That is not the case. They essentially have just gone to a local by local instead of a statewide. So they have not lifted all the restrictions in California, far from it. I just want to tell you that. If there are changes, obviously we'll share it with you as soon as we can.
Next question comes from Laurel with the Spokesman Review.
Hi, Governor. This is kind of a follow-up to Sarah's question, so it might be for Michelle as well. But I just saw that the Department of Health hotline is available now, and we had originally heard it wouldn't be able to accept appointments for the mass vaccination sites until Friday. Is that still true, or can folks start to make those appointments using that hotline now? And then I also wanted to clarify the 500 doses that were administered, is that both first and second doses, or is it really 500,000 people who have received doses?
Michelle, would you like to address both those?
Yeah, for the first question about the phone lines, I'd like to, if you could follow up with the DOH PIOs. I know we're working on getting that set up as quick as possible, but I want to make sure you have the accurate information, which I don't have at the moment. So we will find out if that's set up today. The 500,000, that is both people who, that is the number of doses that have been administered and reported to the state. So it does include first and second doses. And if you look at our new vaccine dashboard, it has a breakdown between first and second doses on there.
Next question comes from Glenn with King 5.
Governor, how are you doing? I have a basic, kind of a fairness question. Yesterday, the Hospital Association said they were worried about people double booking slots, appointment slots to get their vaccines, fearing there may not be slots available when they need them at the end of the day at certain locations. And then also Overlake Medical Center said as they are adding more slots to their considerable effort, they also sent an email to all of their folks, their employees, their board members, their donors, their former employees, their volunteers, to say if they have open slots, this will give them a chance to fill those slots. So all those are taken up. So again, when you hear of that, what is your sort of reaction to it?
Well, first off, on the double booking, it's certainly understanding that people will try multiple places. But I would just really ask people, if you do get one appointment, you know, don't take other appointments. I mean, it's fine to ask, but if you do receive an appointment, accept it and don't clog up the system denying somebody else a life-saving medication. You know, at the moment, what I can do is ask for people to act in a fair way, and I believe the vast majority of Washingtonians will. But it's like everything else, there'll be somebody who didn't get the memo who's not helping, but that's not going to stop us from acting fairly for the rest of our community. So if you get an appointment, stick with that appointment. If you get 5 appointments, you got 4 other people who aren't getting their shot until you don't show up for your appointment. So we really need people to act like we've done where we've had similar emergencies, like the Oso mudslide or World War II. People pulled together. We need to pull together here. This is a moment where we got to pull together and think of others. And I think the vast, vast majority of Washingtonians have. And the reason I believe that is we have demonstrated, as I've said many times, we've done much better than other states. We're better in 45 other states in our infection rate. And it is because Washingtonians have pulled together already in many ways, and I'm confident we'll continue to do so. I did hear about the story about this one hospital. If in fact they were giving preference to some VIP list, that's not the way to do it. That is not acceptable for us. We need to give everybody a fair shot at the vaccine. If that's what was going, it's simply not acceptable. We need fairness in this system, and we've got to maintain public credibility in this system. I'm told that was, whatever they were doing has stopped, and that's good news.
Next question comes from Jerry with the Everett Herald.
Governor or Michelle can answer this, I hope. You've stood up the mass vaccination sites, as you noted, and there's another 800 plus providers. We learned today the state has determined that 45% of each week's allotment will go to the mass vaccination sites. I wondered if you could delve into a little of the background of how you came to that number, why that number.
Yeah, that's as we're standing up these sites right now, we wanted to look at what is the throughput, what could we do there, what's realistic with the amount of vaccines we have there, and 45% is the goal. I think actually the actual number ended up being lower for those sites for this week because we are just balancing only 100,000 new doses each week for first dose allocation. So that's we're building infrastructure in every place that we've been talking about where we'll need it. That includes mass vaccination as a strategy. It includes our pharmacy system. It also includes all of our clinics, including our community health centers. So we're working to get vaccine to all of those. This week, we're standing up and getting some lessons learned from these 4 mass vac sites and wanted to make sure that they had enough throughput and enough volume to maximize the amount of people we could vaccinate in those sites and ensure that we were using doses kind of within 5 or 6 days at those mass vaccination sites.
If I can add something, I do think don't ignore the importance of the pharmacies as well. We have opened up this pharmacy stream that has been very productive so far. We want to thank all the pharmacies for helping out. And we think that's going to be significant. And we have to plan to have the infrastructure to match the eventual increase in doses. That's one of the reasons we've adopted a strategy of having many more places and organizations involved in this. We're anticipating the arrival of more dosage in the upcoming weeks, and we want to be ready for that. And that's why we're increasing our capacity dramatically. So it's good long-term planning, and obviously it's good short-term planning. Can I show those numbers again? Just show our January 19, if you can put this graph up. If you look at these numbers, frankly, it's pretty significant. We've gone from the 19th of January, from 16,000 just to the January 25th to 39,000 plus. and the next day it was replicated at that number. These are pretty impressive rate of increase. And while we're doing this, you know, it's not going to be a seamless system as we develop this aircraft. But we are moving the needle big time, and I know people are anxious for us to do that. And that's why we're so intent on accelerating this.
Next question comes from Tom with Northwest News Network.
Hi, thank you, Governor. I'm wondering if your office has given thought to declaring a school employee vaccination day, as some legislators have suggested, as a means of getting all students back in class faster by letting all teachers, regardless of age, get the vaccine on a certain day very soon.
No, we have not given consideration to that, and a couple reasons. Number one, there's a mathematical equation here that's we have to face. It's a reality. It's a very difficult reality. Is that when you give a 25-year-old second grade teacher who I love, these are miracle workers. I have a grandson who has the most wonderful teacher I've ever met right now, helping him out. She's doing astounding work for him. But the reality is, if you give her that vaccine, her 80-year-old grandmother doesn't get it. And her 65-year-old, or I'm doing the math wrong, mother doesn't get it. So every teacher that is vaccinated today means one less 80, 90, 100, 70, 65-year-old person gets the vaccine. And we don't have enough vaccine for those folks. There's 1.7 million people in that category of over 65 or over 50 in congregate or in multi-generational housing. 1.7 million people. And we're only getting about 116,000 doses a week. So if you do other folks, it means one of the older people who might be 100 years of age can't get vaccinated. And I just do not believe that 25-year-old teachers think they should get in line ahead of their 80-year-old grandparents. I fundamentally don't believe that. I think if you ask teachers, they'll tell you they agree with me. So while we have limited doses, we simply can't do that today. We hope to do that as soon as we can. And as I've indicated, we're making real progress to accelerate the day when we can do that. And the educators are in the next tranche after we get through this, the folks of a certain age. That's number one. It's a decision that we're going to save lives, and the way to save lives is to vaccinate the people whose lives actually are in danger. 9 out of 10 of the deceased are over 60 years of age. We are vaccinating teachers who are over 65, and those over 50 in multi-generational hospitals today. But that's the people who die. And it seems to me that I think the educators I know think that we ought to vaccinate the people whose lives are at risk today, and that's these people. So we're doing everything we can to accelerate the vaccination of this group so we can get to the next group to move forward. Second thing, I believe that we can open up our schools safely now as long as we use proper hygiene and good systems. We have proven this. We have proven this because there's over 100,000 pupils in the state of Washington who've been doing this safely for months now. This is not an academic exercise. All you have to do is go to schools around the state who are doing this successfully with minimal, very minimal in-school transmission. And so the fear of this is understandable, but it's not backed up by our experience. Because our experience has shown you can operate a school safely. We're doing it all over the state of Washington today. And the reason we're doing it is because educators are extremely smart, very disciplined, and we have discovered ways to do this in a very safe way. Spreading out the students, using masking, having cohorts, don't allowing them to mix at recess. So the proof is in the pudding. We can do this safely today. And I believe we ought to. I'm pleased that since we started our new metrics on this. So we've had quite a few new schools that are going back to on-site learning. And I think that's a joy both for educators and for students and for parents to be able to return. So that movement is moving in that direction. Now, the third thing I will say is that there's no zero risk. Anytime you step out of your living room, there's some risk, right? There's no zero risk environment. But this is not to have educators go back in the classroom. We're not asking more than we've asked for our grocery clerks. We've asked our grocery clerks to go on site and do their job, and as a result, we have food to eat. We're not asking any more than we ask of bus drivers who've now gone into buses and make sure that we can commute. It's not anything more than we've asked from our childcare providers. And they've stepped up to the plate, or to firefighters, or to police officers. So to the extent that communities do make a decision to go back to on-site learning, they're asking educators no more than they have asked for the other parts of our community that keep us safe and help our community thrive. So for all those reasons, I am looking forward to the day when we can get to the next tranche, which are educators. And we've also made a provision. As you know, right now it's set up so that educators, grocery clerks, agricultural workers, the people who feed us, over 50 would be in the next tranche. But we have added flexibility so that if you do have someone go out to the school, they can vaccinate everybody in the school who are actually at the school educating people regardless of age. So we have added that flexibility. I'm hopeful that was one of the reasons that Bellevue has been able to find a way to agree to start going back to school in some of their early grades. So I'm really hopeful we're going to get there as soon as we can. It's not today, but it's coming.
Time for a few more questions.
Next question comes from Suzanne with Coma 4.
Hi, Governor. This is something you've addressed before, but I'd like to ask it again. Thousands of people who qualify for the COVID-19 vaccine are not able to get it. What are you telling them? How are you reassuring them? And what is Washington State doing to fix this problem?
Well, I'm trying to think about what I haven't talked about for the last 40 minutes. I'll try to summarize it. We are doing everything humanly possible to expand and accelerate the number of Washingtonians who can get a vaccine as quickly as humanly possible. And we are doing that. We have doubled the number of people we can vaccinate a day. In the last week, we have expanded the number of sites that are available for people to get the vaccination. We have brought in a public-private partnership that can bring in new assets so we can have max vaccination sites. Working with our federal partners, we're now going to have an expanded supply from the federal government of about 16% next week for the next 3 weeks. We have improved the ability to get appointments through our data systems, and we're still working to improve those. And we have asked people to inspire them to help us as volunteers, as people to help their relatives, and consider themselves part of this statewide team. So we're doing everything we humanly can. Ultimately, it depends on how many doses are provided to us by the manufacturers. That's the limiting factor. But we will get shots into the arms of people to the extent we get these doses, and that's good news. And I am just telling you, if you would have asked me a year ago if we could have had 500,000 of vaccine with a 95% accuracy administered in late January 2021, I would have said you're nuts. There's no possible way that we could get that done. But we are getting it done, both because of the miracle of this vaccine, which I encourage everyone to get, and because we are adopting these measures to increase vaccination rates in our state that I think we ought to be proud of. And we're not done yet.
Next question comes from Hannah with Cairo Radio.
Hi, Governor. Just a couple of quick things. One, you mentioned some special syringes to get an extra dose out of vaccines at the beginning. Do you happen to know when those will be distributed? And then I know police accountability, it was a big priority for you this session. Wondering if you have any thoughts you'd like to share about what we saw in Tacoma this weekend.
The syringes, we were told today by the Biden team that they will come with the product. So when we get the next shipment next week, the syringes will be with the shipments. And that's great news because it increases the capacity of the Pfizer product by 20%. That's an amazing boost for us. So that's really good news. We are moving forward. I had a discussion with a legislator about 2 hours ago about our independent investigations bill, and we're making good progress on that, so I'm happy about that. Situation in Tacoma, we want to make sure that any police violence gets investigated and appropriately fair prosecutorial decisions are made. Obviously, all of us share a feeling that we don't want to see any police cars hitting any citizens, and that's pretty clear.
Last question?
Final question comes from Carolyn with the South Seattle Emerald.
Okay, well, listen, we lost the Emerald. Let me make a final comment if I can, and it goes to the heart of some of the questions.
Can you hear me now?
Yeah, go ahead.
I'm so sorry about that. I apologize. Thank you so much for taking my question. I was curious, are there any plans in place for the scenario in which the pandemic significantly worsens here, given that the more contagious and potentially more lethal, according to some recent but still, uncertain science, B.1.1.7 variant has now entered the state? I was curious if you're prepared to potentially shut down the state again in a similar way as around the same time last year, but also potentially have more financial supports in place for businesses and workers.
Well, we are providing more support for our workers. As you know, I've provided over $100 million through our actions in the last several months. Legislators are planning in the near term, the next several weeks, to do another package of over $100 million. So I'm quite confident there will be increasing support for the hard-hit businesses that have been so hard on so many businesses throughout this pandemic. In answer to your question, you're darn right we're concerned about these variants. If they are 30 to 60% more transmittable, that's obviously a concern. And there is some concern about increasing mortality rates associated with them, although that is uncertain. So yes, we're very concerned, and that is why we're doing two things. Number one, we're going as fast as humanly possible to get more vaccines distributed. And number two, we are encouraging people to up their game. Whatever we were doing 3 weeks ago to protect ourselves and our families, whatever kind of mask we were using, whatever rules we had of not having people come into our homes to socialize, we got to be more rigorous now because we have a greater threat now. These variants, are substantially more dangerous from their ability to transmit this disease. And there's not one, there's 3 or 4 that we've already identified. And they will get here, despite our best efforts. I'm glad the Biden administration has reversed the previous administration's ignoring of the need to stop travel. So the administration has now put a limit on travel into the country from South Africa and other places. That's a really good move. Glad the president did it. But we got to know we've got to be more vigorous and more rigorous and more demanding. I know how hard it is to not have a friend over for dinner to your house that you've known for 50 years. It's really hard for any of us, myself included, to think, well, geez, how could Steve and Annie be dangerous coming over? We have known them for 50 years. But it's that kind of individual decision that can save a lot of lives right now, particularly with these new varieties coming in. And so I'm really hopeful that the knowledge, and thank goodness we have the foreknowledge, because we saw what happened to Great Britain, will arm us to be even more vigorous in our efforts to save ourselves. And during this frustration, if I can, I was asked earlier, what would I tell people while they're waiting? I would tell them that their frustration and their desire to get this vaccine right away is certainly understandable, but we have our ability to protect ourselves right now in the things we do. This virus doesn't have not only 2 legs, it doesn't even have 1 leg. The only way it can get us infected is if we let it. And so I'm really urging people for whatever ounce of frustration they have, they also amounts it with 2 pounds or 2 tons of self-defense mechanisms. And I hope people will do that during the next several weeks and months to come. If they do that, we're going to save a lot of lives. But today, we are saving a lot of lives. Having over 500,000 doses of this vaccine, I got to tell you, that's a good story in the state of Washington. But we hope to have a lot more good stories in the upcoming weeks. I don't think we need any more questions. With that, I hope you'll be well and take care.
language backgrounds, and I'm assuming that your goal is speaking to a broad measures of diversity, but I thought I would check in with you.
Thank you for that question.
May I speak?
I think he was addressing the question to me, and I'll offer you an opportunity to speak afterwards, Leave. Thank you. The intention was certainly to address a broad range of underrepresented physicians by category, and I think when we look at the data, there are some communities based on ethnicity or zip code that are more underrepresented